Hello, my name is Dr. Adil Bharucha. I am a gastroenterologist and professor of medicine at Mayo Clinic in Rochester, Minnesota. On behalf of my co-authors, I'm here to share a few snippets about our article entitled Aging, Obesity, and the Incidence of Diverticulitis, a population-based study that will appear in Mayo Clinic Proceedings. As you know, diverticulosis is common, particularly in the elderly. Diverticula are harmless until they get inflamed, that is diverticulitis, or bleed, when hospitalization may be required. In fact, diverticulitis and diverticular hemorrhage are the most common gastrointestinal diagnoses among hospitalized patients in the United States. So we previously showed in a study from Olmsted County, Minnesota, where Mayo Clinic is situated, that the incidence of diverticulitis increased remarkably by 50% between 2000 and 2007 compared to the two previous decades. And we wondered to what extent this increase was explained by aging and obesity in the population. So we used creative methods and found that aging, the increasing prevalence of obesity, and the increased incidence of diverticulitis in people with normal body mass index account for the increased incidence in diverticulitis over time. Between 1980 and 2007, the prevalence of obesity increased from 12 to 49% and in all people, and from 19 to 40% in patients with diverticulitis. By comparing patients with diverticulitis to the overall population, we determined that aging explained 48%, increasing obesity explained 47%, and the increased incidence of diverticulitis in people with normal BMI explained 20% of the increased incidence. Next, we were curious as to whether increased BMI was the actual culprit or only a surrogate risk factor for increased visceral fat, which is associated with inflammation and the metabolic syndrome. And to address this, we compared the amount of visceral and subcutaneous fat in abdominal CT scans between nearly 400 diverticulitis cases and 400 age and sex matched controls, and we found that increased visceral and subcutaneous fat are independent risk factors for diverticulitis. In fact, after adjusting for fat content, increased BMI per se was not a risk factor for diverticulitis. So this study highlights the unique advantages of large population-based cohorts, as in Olmsted County, for studying the epidemiology of common conditions over time, and also for understanding how various factors such as age and BMI contribute to temporal trends. These methods can be readily applied to many other common multifactorial conditions. And from the perspective of clinical practice, perhaps actual or surrogate measures of visceral fat, such as waist circumference, should be measured in individuals with diverticulosis in order to identify people who have an increased risk of incident diverticulitis. And finally, perhaps future trials, such as of aminosalicylates to prevent diverticulitis, should stratify treatment based on visceral adiposity. Thank you very much for listening to this podcast, and I hope you enjoy reading the article.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.